Hi, so for this case, we're going to go over an equine case, and we're going to look at sedatives and analgesics in horses. So the case we're going to present is Red. Red was a 7-year-old thoroughbred gelding. He was used for light pleasure riding, normally housed in a large pasture with 4 other horses during the day, and he was brought up to a small individual paddock with a run-in shed at night. While in the paddock, he was fed 1 scoop of commercially available horse feed concentrate morning and night with 2 flakes of grass hay at the nighttime feeding. He was fine in the morning, but the owner called you now because Red didn't eat his evening feed, which is very unusual for him. Red's one of your regular customers, and you know that he is up to date on his vaccines and deworming. The owner's had him for about 4 years, and he's had no previous illnesses and no prior episodes similar to this. All right, so you were already out in your truck when the owner called you, and you head to her farm, and it's about 45 minutes later that you get there, and as you pull up, all right, so you were already out in your truck when the owner called you, and you head to her farm, and it's about 45 minutes later that you get there, and as you pull up, you can see Red there in the middle of the screen, and these are the signs that he is exhibiting. So let's watch Red for a little bit. All right, so let's go over some of the signs that Red is displaying. So you could see at the beginning there, he was pawing at the ground. He went down on his knees for a little bit, which is a very abnormal posture for a horse. And then he eventually went down into lateral recumbency, sternal recumbency, and a little bit of rolling in between. So these are all classical signs of abdominal discomfort in the horse, which is broadly termed colic. And now it's our job to figure out why Red is colicking and figure out how to treat him. So the owner goes out in the field and grabs Red and brings him up to the run-in shed. And the first thing you're going to do is perform a physical exam, right? So you do your physical. The temperature on Red is 100.6 degrees Fahrenheit, which is normal for a horse. Pulse 56 beats per minute, which is elevated for a horse, as is the respiratory rate at 24 breaths per minute. GI sounds are absent in the left upper quadrant and decreased but present elsewhere, which goes along with our potential diagnosis of colic. CRT is about 2 seconds, and the mucous membranes are pink and slightly tacky. So we've got some relevant clinical questions to go over at this point. We need to figure out how painful is this horse. So I like to classify the degree of pain because that kind of leads me down the path of how aggressive I need to be with sedation and analgesia in these cases. So mild, moderate, or severe pain. What drugs do we have to facilitate a safe and thorough colic exam, right? So in this case, we want to palpate the horse to see if we can come up with a better diagnosis than just colic. And we also want to pass a nasogastric tube to make sure there's no fluid buildup on the stomach, and we can also use that to administer some treatments. We have to be a little careful here, right? So on the premises, remember we're out on a farm. We're not in your vet school's hospital. So we don't have any stocks, and we don't actually have any stalls on this premise. And the owner right now is the only one available to help restrain the horse for examination. So you don't have 2 techs with you and 5 students. So it's just you and the owner out in the field. So that does have to also affect your therapeutic choices, particularly when it comes to sedation. So aside from sedation, we also need analgesics for this horse, both during and after the exam, right? We want to provide the analgesia during the exam so that the horse doesn't try to go down and roll while we're either passing a tube or, even worse, performing a palpation. So let's go over some of these using the Pac-Man approach.